Good evening. The total COVID case count in Canada is now at nearly 30,000. But many health experts say the increase is slowing. This comes as Ontario health officials say we could soon reach the peak of the outbreak after the numbers have appeared to have eased over the last week. The number of COVID-19 cases climbed by 514 today in Ontario to a total of almost 9,000. There were 38 new deaths reported to a total of 423 across the province. In Quebec, 143 more people have died of COVID-19, bringing the provincial total to 630. There were also nearly 1,000 new cases for a total of close to 16,000. Some good news out of PEI. They are reporting no new infections, keeping the provincial total at 26. We want to bring in Cynthia Mulligan now. Cynthia, some cause for concern from the province today, despite that good news from the health minister who's focusing on long-term care homes.
Well, Janella, she said that Ontario has not hit its peak yet, and we are in a holding pattern. And seniors in long-term care remain a key focus of the provincial government as the pandemic continues to wreak havoc in long-term care.
These homes are turning into the front lines of this battle. And yesterday, we sent in the cavalry. Medical SWAT teams are being deployed to long-term care homes who need it most. We're bringing in the very, very best.
For the first time since the pandemic hit Ontario, more seniors in long-term care tested positive than the general population. Of the 514 positive tests in the past 24 hours, 271, or 53%, are from long-term care. Over the past few days, the increase in cases in Ontario has stayed in the 6% range, and the catastrophic ICU cases projected in the modeling 2 weeks ago have not materialized. It predicted there would be 1,200 cases by now. Today, there are 248 cases in ICU.
When are we going to get the new modeling, and where do you see us overall in this battle when it comes to the curve?
Well, Cynthia, I give all the credit to the 14.5 million people in Ontario that practice social distancing, self-isolation. That's the reason we're in a relatively half decent. I'm not even going to say the word good because we aren't. This could come back and bite us in the backside in about 10 seconds. So we have to be very cautious moving forward. On more modeling, what I understand, and I will confirm it, we're going to be gathering more numbers this week and hopefully sometime next week.
There are currently 807 people in Ontario hospitals, but that number doesn't reflect all patients. Today, Dr. David Williams, the Chief Medical Officer of Health, acknowledged they don't know how many seniors have actually been transferred from long-term care to hospital, but it's likely not many.
Right now, we haven't been made aware of a lot of transfers.
And I want to update you on a couple of other stories. Remember yesterday I told you about the 99-year-old World War II veteran who was transferred from hospital to long-term care home just yesterday? Well, also yesterday, obviously later in the day, the government sent a directive to all hospitals asking them to temporarily suspend all transfers to long-term care. And I've also told you in the last couple of weeks how all cancer or most cancer surgeries have been canceled, postponed, while the hospitals were trying to build capacity. Well, one of the women that I spoke to who had her breast cancer surgery postponed a couple of weeks ago, good news for her, she's having it tomorrow.
That my surgeon was advocating for me. I'm very, very grateful for that, and it seems to have worked. I prefer to just sort of keep looking forward. All right, we're going. I'm so grateful we're getting the show on the road.
And I've been asking the government for 2 weeks now exactly how many surgeries have been postponed, because it's not just cancer surgeries. I have yet to receive an answer, and I'm not sure at this point how many surgeries are now being rescheduled. We'll keep on top of that story.